10:31 on a beautiful day. I have some guests in from the Galveston County Health District. We're going to be talking to Amy and Jasmine. If you have any questions, feel free to ask. Go ahead and share this out. Let me know what you got going on today. We're going to have some fun. Here we go. Good morning. This is KHEA Radio, 99.5 FM. This is Kickstart. My name is Gardy. I have some guests in studio. I'm going to let them introduce themselves and then share the organization that they're here representing today.
Hi, my name's Jasmine McMullin. I work at GCHD in the WIC office.
Hi, my name is Amy Cotharn, and I'm the Chief Nursing Officer at GCHD.
Right. So it's been an interesting time, I'm sure, this last year up until now, going forward to work for the Galveston County Health District. What has that been like? Have y'all been pretty busy? Kind of relaxing vacation, or how's it been going so far?
Take it first.
Sure.
Okay.
So we did have to adjust because of COVID, and we started doing what we call contactless appointments. Right now, we do have some waivers in place to take care of some of the things that we would traditionally do inside. We're able to do most of the things on the phone, or to where we can have links sent, and things can be sent online securely. And so we've been able to not get to see the kiddos in person as much, but see them outside in the office or in the car, so we can still deliver those benefits out for the WIC offices.
If someone's not familiar with WIC, what do y'all do?
That's a good question. So we help and give food benefits for income qualified families for children under 5, pregnant, breastfeeding, and postpartum women. We also give breastfeeding support. We have a pump program, and we have classes to take care of virtually now, but as we continue to have things go better, we'll have in-person classes as well.
I've had the opportunity to interview the food bank, and we have a food bank, drive up here on every Thursdays at the facility here at Abundant Life at KHEA Radio. And one thing that we've talked about in the past is during the summer times, a lot of these kids, they'll get their meals from school. So what do y'all do? Don't y'all offer some assistance, right?
Yes, we are doing a program right now out of our Texas City office. Anyone in the area can come. It's weekly, Wednesdays at 10 o'clock for the first 50 people. So it is first come, first serve, and it's for children between the ages of 1 and 18. You can get a full week's of breakfast and lunch meals picked up at that location. All right. So we have Amy as well. Amy, can you remind everybody what's your role that you play at the Health District?
Okay, as of late, it's Chief Nursing Officer. My response to the pandemic, or our response, has been primarily an epidemiological and a medical response. So it has been a crazy 15 months. It started, pretty much February of 2020. And it started with, epi investigations and monitoring COVID positive patients. And, we had public health has been kind of in the shadows for quite a while. So to say that we are understaffed for a pandemic is just minimizing it extremely. So we had nurses and epidemiologists getting to work at like 3:30 in the morning, 4 in the morning, just to get the day's work done and not finishing until well into the evening. And it's just been that pace for like I said, 15 months. And then we jumped onto the vaccine part of it. But that's not all we do is COVID. I mean, that's been the bulk of it the last 12 months. But now that most folks are getting their vaccine, we're excited to get back to our regular services. And, we have many different kinds of resources for the community, from, appropriated medical care to STI clinics to tuberculosis care. So many resources to the community that we're excited to get back out there and start offering.
What's an epidemiologist?
So it's someone that studies the disease process and disease. So they take the not so medical stance, and where they're actually investigating the disease and how it's traced or how it's passed. So it's a lot of investigative work. And then it's handed off to like the medical staff or the nursing staff, where they're checking with Galveston County residents on actually, like, from a symptomatic standpoint. How are they doing? Do they hear something in their voice where maybe they're short of breath? They need to make a referral to the ED. I think last I heard we were one of the only counties in Texas to offer this service. So that's pretty exciting.
Yes. So I had the opportunity to talk to Dr. Kaiser multiple times last year, and he was always, I talked to Ashley and reach out or whatever, and it was very easy to get a hold of him, which I thought was amazing.
Yeah.
Just being there, and I had the chance to talk to the Daily News earlier this morning, and he was honored as the Citizen of the Year.
Yeah.
And they were talking about all the volunteers and the people and how Walter Hall was running maybe the best in the state. That's
Yeah.
not easy to do. How did y'all do that?
That's a great question. A lot of tired feet. So we realized that, phase 1 was tracking the disease and monitoring the patients. And phase 2, we had to come out hot and heavy, and that was vaccine. And so we partnered with Operations of Emergency Management, county, and public health. And we all came up with a plan. We walked through Walter Hall, and we identified how we could maximize the amount of people running through, and got a list of people willing to volunteer, which usually consisted of medical students, nursing students, the Medical Reserve Corps, MRC, which is often retired nurses and doctors and dentists and veterinarian, construction workers, and they just volunteer their time. And with that collaboration, we were able to, I remember the first day we did 800, and we were just like, oh my gosh, this is so much. And then literally within a week, we were jumping to like 2,000. And then the next week, 5,000. And so we've been consistently, as a county, on the top end, the top 3 most vaccinated counties in Texas. And I think it's a direct reflection of our drive and our efforts. So
Yes, you were mentioning that there's other things that y'all do, and y'all are able to kind of get back to some of that, as well as spreading the importance of the vaccination. What are the other things that y'all offer?
Okay, so we have a public health nursing group. And they go out into the community, where specifically communities that maybe would have more difficult access to primary care, or maybe not have a primary care. And they do health fairs where they offer free blood sugar checks, blood pressure checks, and then they connect them to resources in the community to where they can establish primary care. So if they identify a person with very high blood pressure, but they don't have a primary home, they don't take medication for it, the consequences of that down the road are not good. So they educate them, and then they connect them to care. So we have that group. They do actually so much more than that. We have an STI clinic where you can come and get tested for any STIs, and they offer counseling. We have our immunizations clinic where you can go in, and it's a sliding fee for any immunization for any age. And there's so much more. I don't want to leave out like environmental, they check restaurants and then check water and make sure our water is, we're able to drink it in the air. And then we have EMS, don't let me forget anyone.
The ARC.
The ARC. Yeah. Animal Resource Center. That's huge.
Yeah.
We could not function without the ARC. And then we have our federally qualified health center, Coastal Health and Wellness, next door. And that is a sliding scale clinic where you can get dental care, substance use disorder counseling, primary care, OB care. We just have a dynamic group that are so willing to serve. And so I think we probably offer even more than that. I don't know. And vaccine.
Yes, and the vaccine. So there was a point where, some businesses were required to shut down, and even some, if there was a surgery or procedure and it wasn't, I guess, like mandatory or life-threatening, then that was kind of put on pause. So a lot of people maybe assumed like, oh, I won't go to the doctor. What goes on in that realm now? Like, should they go and get that checkup, or what do they need to do?
Yeah, no, I'm so glad you brought that up. So we need to get people back to the doctor. And if they don't have to have a doctor, we need to find them a doctor. Preventable chronic disease is very significant in our community, and it has to be managed. And if it's overlooked, there's consequences for that. So yes, we've been hiding in a hole the last 12 months, but it's time to get out of that hole and take care of yourself. Self-care, mental health care. And getting to the doctor and getting your checkup and making sure you're up to date on your vaccinations and whatever medications you might need to manage your if you have a diagnosis. It's time. It's time to get back to that.
Jasmine, how did last year, COVID affect the WIC office? A lot of the times that we mentioned the kids will get that meal from school, and sometimes the schools weren't open or they weren't comfortable going back. How did that affect our area in your office?
That's a good question. So we were able to try our best to reach out with our contactless services. Right now, with the way that we are doing things, we are keeping our Dickinson and Galveston open up full time, at least through September. We're just trying to make sure that people know that they have clinics nearby, that if they qualify with their income base, which they can look on the texaswic.org website or gchd.org in our WIC section, they can find those details. But it was was really hard because at first, like you said, everyone was scared even to go out in those contactless appointments. We were able to set up those parameters and social distance each other and work it out to where we could still see people every day as much as we could and get those benefits out to people. If they were quarantined, we could work with them to try to see if someone who could meet at their door to where there was no contact with everyone could still be their primary second person to get those benefits to them. So we were still able to see and receive those WIC cards, which had those food benefits, and get that audio nutrition information on the phone.
So before we went on air, we were talking a little bit about a passion project that you have with a podcast and cooking healthy, and that's important, especially, I mean, for everybody. But if you are receiving some assistance, is it possible to still cook, or is there any partnerships y'all have with any local places to make that easier for people?
Oh, yes, for sure. So what we like to do, too, with some of our classes is talk about the opportunities of being able to cook with the WIC foods that we have. Those are actually in the works at the WIC office, too, of trying to do virtual opportunities of doing like cooking classes with our WIC programs. We do give out lists of referrals, and like we said, with the food bank, we have opportunities to get pre-made foods. But we always like to do cooking ideas to get an idea of what we do with all that WIC food. Because every now and again, especially like with milk and stuff, you're kind of like, what do we do with everything? And in those personal one-on-one times in those group classes, we can have that opportunity to think of some ideas to have creative WIC delicious foods.
That's awesome. Ashley had sent me some information about maybe a partnership with Galveston's own farmers market.
Yes, actually. So right now they still have the vouchers available. It's $30 per person who's already on the WIC program. They can bring their shopping list with them to the farmers market, and they can get those vouchers starting again on the 27th at their new location. It's Market and 28th Street. It's across the street from the Red Light Coffee Roaster from 9 to 12 on Sundays. And it's first come, first serve for the vouchers, but they still have them available, and they can use those through October 31st.
Right now, it is 10:43. This is KHEA Radio 99.5 FM. This is Kickstart. My name is Gardy. I'm talking to Jasmine and Amy from the Galveston County Health District. Amy, yes. Whenever I talked to Dr. Kaiser a couple times last year, one thing he always said is like, we know so much more now than we did, at the beginning. What are some, maybe even some myths or some misconceptions about the vaccine or COVID in general that we know so much more now this year than we did last year?
Okay. Yeah. So let's start with the popular one. The COVID-19 vaccine will give me COVID infection. No. So the COVID vaccine is not live. Therefore, it cannot give you the infection. So COVID vaccine is safe, and receiving the COVID vaccine, you will not. It's impossible because it's not a live virus. So that's how you get sick, is from a live virus. So the vaccine itself will not make you sick. If you've already had COVID, I don't need the vaccine anymore. That's false. And that's one of the things that has made COVID so tricky, is that you can get it, and then you can have antibodies for a short while, and those antibodies go away, and then you can get it again. And typically, we've seen that time frame for monitoring patients is usually 8 to 12 weeks, 2 to 3 months. You can get reinfected. So just because you've had it once does not mean that you can't get it again. Let's see, maybe the manufacturers cut corners in making the vaccine, and that is not the case. There were no corners cut, and specifically in the scientific process and safety process. And I think that the CDC is very transparent, and I encourage folks to go to their website to take a look at that transparency on how the vaccines are made and what went into them. I like to to me, this was an eye-opener when I thought about it. Have you ever had chickenpox?
Yes.
You have? Okay. All right. Well, a lot of the younger generation, they have not had chickenpox. And none of us have really experienced polio, right? Or pertussis. Those things because we received a vaccine. And that's why vaccines are so important. They protect us, from preventable disease. Let's see, what's another one? Will it change my DNA?
Because it's the mRNA. That I wrote that down. I wanted to ask
so let me, because I really want to make sure that I'm saying this verbatim. So basically, mRNA stands for messenger ribonucleic acid. It's a mouthful. And it's basically just a piece of protein. It triggers your immune response. Your DNA is located in your cell, like in the middle of your cell. Well, this piece of protein has no way to get into the middle of your cell. Therefore, it can't change your DNA. And I know that sounds very simplistic, but that's the best way to deliver it without just going over the top to where, it's, I think, maybe someone who actually
the way someone
creates
explained it to me, it
vaccine.
was like, well, here's a circle, and
Yeah.
that protein's like on the edge of it or
Right.
something
It
like
can't
that.
get in the
Yeah.
middle. That's even a better way to
Yeah.
explain it. Yeah. So that's a couple. I mean, some folks say the flu vaccine will protect me from COVID. That's like saying a Rottweiler is the same as a poodle. They're two different viruses. So the flu vaccine cannot protect you from COVID.
Mm-hmm. And I guess one thing that was interesting, and a lot of people, it depended on which aisle you were looking and which way you're looking at things, like, well, the flu was so low. The flu last year was the best season that we had for flu because nobody was getting it, but the COVID numbers and all this stuff. And there was a lot of different reasons for that, which was pretty interesting because a lot of people were taking precautions of washing their hands and using sanitation, using masks and all these other things. What's the difference as far as like being transferable between like the flu and COVID?
So I think pretty much the things you identified, like washing your hands, wearing a mask, we don't always want to social distance. We want to stay next to our friends, but those two are key. Washing your hands and wearing your mask can protect you from both. I think the difference is COVID is more contagious at this point right now than the flu. Is that subject to change? Very possibly. But I think, again, they're two different viruses. They're not necessarily comparable, although they can be delivered in the same fashion or received in the same fashion or caught in the same fashion. But they're pretty. I mean, that's it.
Yeah, that's what that's what I had heard about everything, is just that it's more contagious, I guess, if you will.
Right.
And so I know my wife, we were just talking the other day and reminiscing about, what was it, like the bird flu or something like that, because there was a TV show. It was like Scandal. I don't know if you have ever watched that TV show, and she was just rewatching it, and we watched it together, but they had mentioned that, like the bird flu or whatever it was. And she was like, you remember that? Because people were wearing masks. And she was like, well, what was the difference? And I said, I think that one wasn't as contagious as COVID-19,
Right.
So I guess it's the same thing with the flu, but actually washing your hands and doing those things works.
Right. Definitely works.
Right now it's 1048. It's KHEARadio.com, 99.5 FM. My name is Gardy. I'm hanging out talking to the Galveston County Health District. There's a lot of information on the good things that y'all do, and I'm excited that y'all are here. And it was super close to get here. Did y'all find it okay?
Oh, yeah. It was very easy.
Yeah.
Right around the corner.
Literally right around
We're
the
like
corner.
neighbors.
Like over 45.
Yeah.
And I'm excited for all the construction to be done one day.
Well, me too. We have a WIC bus now that we're going to be able to bring out to like outreach events and stuff. So it'll be nice to not be in construction when I'm driving.
So what do y'all do with the bus?
So it actually can be a full mobile clinic if we need it to be, but we can also do it with outreach for like health fairs and things like that. Cool. So that way people just know, again, that we're out in the area. We're going to try to start in the next couple of months scheduling times to kind of like pop up, but for WIC instead of food trucks. So not the food there, but they'll have the card later.
Yeah. That's a great idea. How is that a new thing, or is that something y'all were doing?
Yeah. So some of the other agencies have gotten them in the past couple of years, but we just got ours this year, so we're really excited about it.
It was last Saturday. My friends at Premier Martial Arts, they got one. Al Garza's Premier Martial Arts. There's one in Dickinson, League City, and they got one in Pearland. And they had it was a Premier Health and Safety Day, and so they were doing some training, and that would have been a good opportunity if they do one again in the future for y'all to go out there.
Yeah,
that'd be great.
That's cool. But yeah, being mobile, that's big because so I think of a couple things. When it comes to the vaccine, a lot of the people were saying if there's a communication barrier, if someone doesn't speak the English or Spanish, if it's not communicated, they don't know, or if they don't have a ride to be able to get there during the time or they're working.
Can I piggyback?
Of course.
So that is so important. And so I mentioned public health nurses earlier, and community health workers and epidemiologists. So once we realized we kind of saturated the market for those that actually wanted the vaccine at Walter Hall, we took a step back and kind of revised our plan, and we've decided to go out into the community. So we have gone to churches, to apartment complexes, to schools, to neighborhoods. We've created heat maps to where we can identify under-vaccinated areas, and literally went out on foot door to door asking folks, is there a reason why you haven't got your vaccine? What can I offer? Any bit of information that may help you make a decision? And then just also offering weekend and evening clinics where anyone can come in. We've tried to make it easier and easier. In addition, also going to places like Our Daily Bread and St. Vincent's to reach that transient population. That's been exciting too. So, yeah.
I know one day we had something here. I think we partnered with the city of Lamarck, and we had some under the awning over there. But I'll see them out at the Doyle Center, Texas City. But just going out, that's important, and I think that's a great opportunity for people just to, if you can't get a ride, or maybe you can walk or whatever, to get it done.
For sure.
Cool. Is there anything else you'd like to share about anything?
I mentioned the breastfeeding before. We do have a 24-hour line that can be called or text. You can. It's wonderful program too, and so that way, that one's actually for the greater community as well. We do have lactation consultants and registered dietitians that are available for our WIC participants, and then our virtual gardening class is for everybody in the community. You can again go to the WIC part of GCHD to kind of get those numbers and everything, so I don't rattle off everything on here, but again, we do our best to work for the whole community. There are pieces that we can only do for our WIC participants too, but it's always good to check out and everything. You can automatically qualify if you're on like Medicaid or food stamps or TANF already. If not, we can look at the income base of the family and see where we're at. And I think I got you everything covered.
If somebody wants to support you guys or volunteer, are there opportunities for them to do that?
Yes. Go to gchd.org. You can go there for everything we've spoken about and more. Also, we have our community outreach calendar on there. So if you need a vaccine still, or you need to go to the STI clinic, or you need, any form of vaccine or immunizations other than COVID, go to our website, gchd.org. But also, in addition to that, we name where we will be the next week in the community, where you can find us. And we usually try to be all inclusive. So we're on the island. We make it a point to hit each city, so we're available to everyone. And then what else? What was the question?
I think if you go to the website, there is a section for volunteering.
Oh, volunteers.
Yeah.
Yes. Okay.
And so that's actually where we go through for our volunteering too. We have sometimes like nurses and med students that kind of have to do it for school anyways, but get to volunteer with us, and they do kind of still have to go through a program as if they were working with us, just for like being vetted and everything too.
But MRC, Medical Reserve Corps.
Cool.
Sign up.
If you are not like a resident of Galveston County, even if you're not a citizen, I had a friend who had a family member visiting from another country. Are they able to sign up and get that vaccination?
Yes.
Have to be okay.
Yes, absolutely. Everyone, anyone, vaccine in arms. Doesn't matter where you're from.
Okay, awesome. Well, thank you so much for hanging out. I appreciate you guys making time.
Thank
Thanks
you
for
so
having
much
us.
for having us.
This is KHEA Radio 99.7.